Many of us only think about our medical needs when we need them. Well, it's a good thing somebody thought about that before we needed them. And today, in the Pivot series, we're going to have a chat with Dr. Makeba Brooks, and she is part owner of Urgent Care Barbados. This is going to be a story for the ages, and I've got the right cup of tea for this. Bigelow. Dr. Makeba Brooks, welcome to the Pivot series.
Thank you so much. I'm so happy to be here.
Now, I know when you think about business, you don't necessarily think of a doctor unless you're thinking, oh, well, of course, she has a clinic, she has a practice. But you and some partners have much more than that. How did Urgent Care Barbados come to be?
So it was back in 2016. We saw the need for better to be done in the healthcare landscape in Barbados. We wanted to do better by our people, Barbadians. We wanted to do better by persons who visit our shores. And we saw deficiencies in both the public sector and in the private sector in the way that healthcare was being delivered to people. So we decided, instead of having people come to the doctor's office or go to the emergency rooms or go to private clinics, how about we go to them? A bit of a throwback or something that was done many years ago. So it was nothing new. We didn't invent the wheel.
Right.
But we did it with a twist. So there was the yearning to fill some deficits some gaps that were in the healthcare landscape, as it were.
Mm-hmm.
Also, we wanted to make sure that we supported the healthcare system that was already in place.
Right.
There were lots of people with non-life-threatening conditions who were going to the emergency room and having to wait for very long periods of time because their conditions were non-life-threatening. And so we realized that there was a significant deficit in what was available out there. And so that's where Urgent Care Mobile, which was our first company, that's where it was born from. Just the need to go into people's homes, give people the care they needed right there and then, wherever they were, from the lowliest of cottages to the most massive estates, just to do more with what we had. And so it wasn't just a doctor coming in to make a diagnosis, but we were coming in there, the fully equipped bag. We had all sorts of portable equipment, so we can do ECGs for you at home. We can do blood tests for you at home and just raise the bar of the level of care that was able to be done in the home setting.
When I first heard about it, first of all, I was invited to come and officially open the ceremony.
You were.
And I walked inside the bus because you all had it perched inside. And I thought to myself, okay, this isn't normal, but this is coming to my home, they say. They're coming to my home. They could treat my entire family without us having to leave home. Did you think at the time, this is definitely going to work? For sure.
No. At the time, we thought this could be something to do until we got our original idea kind of off the ground and running. But the response was overwhelming. People wanted this. People needed this, and they didn't even know that they needed it until it was out there to be offered to them, and people just gobbled it up. And it wasn't just visitors. It wasn't just Barbadians. It was our colleagues. Our colleagues too had the confidence, and they were saying, listen, I'd like you to go see my patient. Wow, just had open heart surgery and it's 2 days later and they're not feeling quite well. I want you to go check on them. Feedback, let me know what you found, and then we can, start treating them, getting them better.
Well, that's rather collaborative, because I was going to ask how the landscape has changed since the introduction of this kind of mobile service, very personalized to your home service.
Oh, well, I think we've changed the landscape of healthcare in Barbados forever. I don't think 20 years from now you can talk about healthcare in Barbados and not mention Urgent Care Barbados, because when we came on board in 2016, there were maybe a handful of doctors who were doing home visits. Usually it was just their patients, so patients that were already present in their practices, and they would kind of set out or dedicate a day a week or half of a day a week where they would leave the clinic and go to person's homes and do home visits.
Right.
Maybe literally a handful, probably less than 5. Now, fast forward to 2024, there are loads of doctors doing home visits all across the island. And over 90% of those have passed through our hands.
Wow.
As doctors that we've molded and trained, and now they're out there doing fantastic work for so many more people. So, I mean, we can only see so many, but the more people we have doing a service like this, the better for the country on a whole.
When I think about Barbados and its topography, it is generally flat. You can generally access areas. What about those areas in our Caribbean neighbors islands that, I mean, hilly, deep in the valley, cannot see a bus for ages, but then there's an emergency or there's just a need for general care? Could something like that be replicated in other islands the way it is currently running in Barbados?
Oh, definitely. So this, I mean, what we're doing now, and it's been an amazing journey. We've been able to have over 100 doctors pass through our hands in just that short period of time, where we have been able to impart on them things that they don't get from medical school or their normal training. And these doctors have gone out into, I mean, they're flung throughout the region and throughout the world. So we have doctors who are training and working in the UK, in the US, in Canada. And because what we do, I mean, large countries do it already. So Australia is big on home visits and mobile medical practices because, of course, they have the outbacks.
Yes. We have to get to the outbacks.
Right? But in the region, this can be done too. So some islands are doing it mostly with hotels and doing, neighborhoods or areas around the hotel industry.
Mm-hmm.
But yes, you can get out. You can get out if you can use specialized vehicles. You can use security if that's a concern, depending on the country that you're in. And this is something that is amazing for persons who are in very remote areas, because you can therefore get to people where they don't have to struggle to actually get to the healthcare facility.
Yeah. Now, you spoke about the hundreds of doctors that have gone through your hands. And you know how we are in Barbados? We have our doctor. This is my doctor. Now, you may not see the same doctor twice. So how do you train in terms of regulating service standards, service excellence?
So that's a big thing. It's very, very important for us that whether you see Dr. X or Dr. Y, what you come away from is that you've been seen by Urgent Care Barbados. The brand itself stands on its own and it represents something. It represents excellence in medical care, excellence in customer service. And so our training is very hands-on. We do a lot of hands-on training with our doctors as they come on, and this continues throughout. So even if you've been working with us for 2-3 years, the training continues. And we use our consultant emergency physicians, because we have a team of consultant emergency physicians who consult on every single case. So every single case that is seen, someone feeds back that information, and there's that collegiate discussion where we say, we bounce things off of each other, and we say, okay, well, you're seeing the patient, but did you check this? So I'm thinking this, can you check on that? And it's that collaboration and that continuous education that raises the standard of the care that you get time and time and time again. With this now, we've also coupled formal training. So we do continuing medical education, 4 points, which doctors and nurses have to gather on an annual basis to be able to maintain their registration on island. And we have now formalized our training. So we have lovely, now since COVID, we started to do it through hybrid, so Zoom. And we have massive conferences every month where doctors from Antigua, doctors from Jamaica, Trinidad are linking in, to get to be a part of this, because it's not wishy-washy. It's high quality medical education that you're getting, speaking to specialists in their fields of expertise, and really, really getting some very good, solid information, which helps the residents who are in training programs and those who are even outside of training programs. And we hit well over 100 people trying to log in to be a part of this. So we cannot be more excited about the training and the education that we're putting into our staff and those even outside of our staff network.
What would you identify as one of the biggest shifts in healthcare since the emergence of urgent care?
I would say the biggest shift would have to be persons paying more attention. And this is on an individual basis. So there's been an increase in awareness for wellness. And that's something that's near and dear to our heart.
Mm-hmm.
We don't just want to come in and fix when there's a problem. We actually want to find that potential problem before it becomes a problem.
Right.
And there has been that shift. We can see that persons now are more engaged. We did a huge thrust towards corporate Barbados saying, listen, you're paying for medical plans for your staff,
Right.
but 20% of your staff maybe access the preventative care side of it. That's no good. You've already paid for it.
Yeah.
And now you're going to see this in sicknesses, lost days, absenteeism, and all these other issues. And so we thought, if we can get to corporate Barbados and we can tell them, listen, be aware, we're willing to come in and partner with you on this.
Mm-hmm.
We're willing to see your entire workforce and get them to a state of wellness or identify to them things that they didn't know was wrong
Right.
before it became a problem. And we're seeing that trickle out and span out to individuals. I know individuals are coming and they're getting their annual medicals.
Yes.
And that's so encouraging because we understand that we have to, it's the old adage, right? An ounce of prevention is worth a pound of cure. And if we can get to things before they become a problem,
Mm-hmm.
we get better, faster treatments, better outcomes overall.
I want you to talk a little bit about maintenance in terms of how do you maintain yourselves, investors, who's literally paying for this?
So Urgent Care Barbados was the brainchild of myself and my partner, Dr. Bandele Majeks, and we brought along with us a group of like-minded emergency physicians to push this forward. About 6 to 10 months in, we actually brought on other investors,
Mm-hmm.
all Barbadian, who had the confidence in our vision and shared the determination that we did to create something amazing. And with them, we've stepped forward and we've gone from strength to strength. So from Urgent Care Mobile, we've recently opened our bricks and mortars. So we now have a standalone clinic, emergency clinic.
Mm-hmm.
We also have Urgent Care Dental. We have a fully automated and digital imaging suite. And we're soon to start Urgent Care Kids.
Urgent Care Kids.
Urgent Care Kids.
Wow, this is quite the revelation.
Yeah.
All right. We're going to get into a lot more because health matters.
It does.
It's a fine world, your wine world, the finest wine and liquor store.
With Flow Business's new smart solutions, powered by super fast, reliable broadband, you'll feel like there are more versions of you working for you. From website design, development, and digital marketing to promote your business, 24/7 business class support to cloud solutions, security, and more. Multiply your growth today.
Dr. Brooks, when you spoke about Urgent Care Kids, it almost sounds like a kids club, but for health. So why the need to separate from your regular urgent care practice?
So kids are special.
Aren't they?
They are. And pediatricians will tell you they're not just small adults. They're actually quite different. So the care for kids is very different to the care for adults. And so we thought we needed to separate it. Right now at our practice, at Urgent Care at the Estates, we have a specially dedicated kids room. Beautiful mural on the wall with lots of action figures. So there's Spider-Man and Pokemon and other things that I don't even know who they are. But the children love it.
Yeah.
And so we want to create a similar space only for children this time. separate them from the adults because we know that they're different, their needs are different. And we want the collaboration. We want parents to feel at ease. We want children to feel at ease. So it's just going to be a happy place for sick kids, unfortunately.
Yeah. But, they have like sick kids hospitals around the world, and they have a certain aesthetic because you're already sick. Let's see if we can make it a little bit better.
Exactly.
Yeah.
Exactly.
I know. So we have so many different ideas going on throughout healthcare. Healthcare, probably not the same type of business as it would be elsewhere where it is like money, 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 but it does cost. What are the real cost implications of health?
Healthcare is expensive, Anyone who's ever sought medical attention in the U.S. would know. Different for our setting in Barbados. In the U.S., it's usually bolstered by the health insurance companies. Here we have, apart from getting the supplies which are not readily available online, and so they have to be shipped in, so we have a lot of times delays and difficulty getting certain things that we want. We also have the cost of healthcare. To physicians.
Yeah.
Physicians aren't cheap. We're doing a home visit service, and a plumber to come to your home is about $150.
Oh, I need that plumber. Go ahead.
And so likewise, you expect that you're going to be paying quite heftily for physicians to come out.
Right.
And so it's very important for us that our staff, all of them, doctors, nurses, admin staff, they all feel supported. They're part of our family. And so we deserve that they should be compensated well for that. And so you have the cost of the doctors, you have the cost of facilities. So things that people don't think about, but even if only 2 people come in an hour, we still need a full cadre of staff.
Yeah.
We need reception, we need security, we need housekeeping, we need nurses, we need doctors, we need accountants, we need admin clerks, we need persons to answer the telephone. All these things are happening and they all add up.
Yeah.
Right?
You don't just turn on half the lights.
No, you don't.
All the lights.
Unfortunately.
All the lights.
All the lights. So it's costly.
Yeah.
But we've found a way to balance that because we think more important than anything else is that the services that we provide should be accessible.
Right.
They should be affordable. It's not going to be cheap, but because of the level of service that we want to give, it can't be cheap, but we want it to be affordable to most people.
And of course, because of the price of importance that we should be placing on our health, that we can't look at a $300 visit as, oh, it was so expensive, as opposed to, now I know what it is, and we can move towards better, healthier, stronger.
Yes.
Yeah.
Exactly. I like to not focus on the cost for our customers to say, because what always warms my heart is if people even say, it was a bit pricey, but it was amazing.
Yeah. Like, what
I will do that again tomorrow.
Yeah, you know what you paid for.
I will do that again tomorrow because it was worth every single penny.
Did you all have a particular time stamp in mind for this is when it's going to turn around, this is when it's going to pay off, this is when we can expand to this, that, and the third? Or did you kind of have to play it as it played out?
That is exactly how it happened. We played it by ear because we had plans of, so 2016 we started, 2018 or so we started thinking about actually opening a clinic. That wasn't going to happen until maybe about 2021, and we were okay with that. That gave us time to scale. And then COVID came.
Oh.
Yeah. And that changed everything. Everything was turned on its head. What we thought we had lined up wasn't lined up anymore. Our visits plummeted. At that time, it was just urgent care mobile.
Yeah.
Persons now did not want doctors or nurses or anybody related to healthcare. Even if your name began with H. They don't want you anywhere in their house because all y'all got COVID. I don't want it at me.
Yeah.
And so our visits plummeted. But we still had to keep the doors open.
Yeah.
Everything still had to continue going as is until things slightly started to change then, where people said, yeah, I don't want you in my house, but at the same time, I don't want to go to a doctor's office. Doctor's offices were also closing.
Yeah, they were.
All around the island, people were closing because of concerns for their own personal health. And I understood that. And so we kept open and drove a little bit harder and said, listen, we're going to do. It took a lot of, we had to talk to our patients. More so, we had to talk to our providers to say, listen, we're there with you. We understand the risks. and we're going to put our money where our mouth is. We're going to provide you with the PPE you need. We're going to provide you with all the support that you need so you can get out there and you can do what you're doing in a safe way.
Right. None of which could have been calculated before.
No.
Yeah.
No. And then we thought, you know what? We're going to put our hands in, and we raised our hand to the ministry and we said, we're willing to do COVID testing for you. We'll do it. We'll take it on. Nobody else wanted to take it on, but we said, we'll take it on. And from there, it just grew and grew and grew. And I think it's our desire to innovate constantly.
Yeah.
To do better constantly. So whatever is thrown our way, first of all, we don't say no. We say, yeah, sure, we'll do it.
And figure it out.
We'll figure out how we're going to do it after. But we're going to do it because it can be done.
Yeah.
You're not asking me something impossible. It can be done. We just need to figure out how it can be done, and we can do that. And so that's how we handled COVID. We took it on and we said, we can do this. And it just went from one thing to the other. And then, okay, we do it better. How about we do a drive-through COVID testing? What do we need to do that? We need technology, and that's a huge thing for us. We leverage technology every single chance we get.
Yeah.
So even when we started in 2016, we didn't start doing paper notes. We said immediately, this is the 21st century and we need to step it up. We were, one of the first in Barbados to really on a large scale take on electronic medical records, keeping where everything was digitized. And so we did that from the jump, and that has just continued.
It did serve you. It did serve you well,
It
though.
did.
Yeah. So I often look at the opportunity to do something. It's one thing to raise your hand and say, I can do it. But when you take the opportunity to show as a consumer or somebody who has to make a choice, once I have seen that you can do it, I don't need to see it once, I automatically feel like, yes, this is a good thing. And this is where I should put my proverbial eggs in this basket. And I think it's important that people, yes, it's a profession. Yes, it's an essential service as well, but it's still a business. And you still have to show that you're able to run this business with all of these attributes, all of these callings. After COVID and all that it brought with it, some opportunity, much like this show. How did things turn around business-wise after, when you were able to say, look, we have done this, we have done this, we have done this, we're doing this?
Yeah. So after COVID, through COVID, we were gaining attention from international persons. So Royal Caribbean had seen what we were doing, and they came asking, hey, can you do our COVID testing? We have maybe 1,400 guests that need to be tested pre-embarkation. You have a 6-hour window. Can you do it? Yes, we can.
We can. Yes,
we can.
We'll figure it out.
Certainly. We got you.
Yes.
And then came Netflix. So they were doing their screening for Outer Banks in Barbados. And they contacted us and they said, hey, we need COVID testing for our cast and crew. Can you do it? And this is what we need you to do. And so that helped. That recognition from outside of our shores, that somebody was somewhere watching and they could see what we were doing, and they felt that confidence also in our product, in our services, that we could deliver. And so we did. We delivered. And that then gave us, I guess, further confidence to say, we can do these other things that we have in the pipeline. We can do it. And that just pushed us on to just continue. As I said, we are always have ideas. We're always sitting down, we're brainstorming, and we're like, this would be good. That would be good. So even when we started at 117 square feet, small office in Belleville. That is very tiny. 2 staff members apart from the physicians, 4 physicians working, and 2 admin persons. 1 to calculate the books and the money, and 1 person to answer the telephone and direct us in taking calls. We grew from that to now occupying a 6,500 square foot space with over 27 doctors in the field seeing persons. In the clinic, we have about 12 to 15 doctors, maybe another 12 nurses. Out in the field, maybe another 40 nurses.
Wow.
And an admin complement approaching 30.
You must look at those milestones and think, did we do this? Was this us?
I do, actually. A lot of times it is, oftentimes people don't, especially as women, unfortunately, we don't look back and give ourselves the kudos that we so much deserve.
Yeah, just a little.
It's so much easier to give it to someone else, to look at someone else and completely big them up and say, oh, girl, you doing it. You're it. And I'm loving it. I'm here for it.
Yes.
But when we're looking at ourselves, we think, okay, you know, it's okay. I still have so much work to do, you know.
Yeah.
We're humble, as you should put it. But yeah, sometimes I do look and think, this is quite amazing what we've done. But I must tell you, that little bird on my shoulder is still like, oh, we got so much more to do. We're not there yet. We're not there yet. And I think that keeps us going because we're not resting on our laurels. We're not thinking, oh, we've made it. We've ticked this benchmark and this, you know, and we're there. We're not there yet.
Wow. I learned through one of the episodes that really what it is that entrepreneurial switch. It doesn't really switch off. It just keeps flicking.
That's
letting you know that the next thing is coming.
That is it.
Now, while this business is expanding, so is your family. How is all of this being balanced?
It's a delicate balance in that. I'll definitely tell you that. But support, I mean, God bless grandmothers. Support is 100% it. And I mean, I could not ask for a better husband. That's the truth. And he does an amazing job of keeping me grounded. He is my biggest cheerleader. When I am faltering and I'm filled with self-doubt and a hint of imposter syndrome, he's there to be like, no, you're in this space because you deserve to be there 100%. And it's, anyway, I couldn't ask for anything more, truthfully. My children are amazing and rambunctious. They're 12 and 9. Ooh. And 12-year-old girl and a 9-year-old boy.
Oh, you did it.
And they're active and they have needs. And without the support, I could not be there for them. I have to be there for them.
You must.
I have to be able to balance all of those roles and give everybody a piece of me without cutting myself up too much that there's none of me left for me.
For you, because you're also Makeba.
Exactly. And so self-care is important. Taking out little slivers of time to just do you whatever it is, whether it's reading or meditation, gym, which I don't do, but I should.
An example.
But whatever it is that brings you joy, cooking, baking, talking on the phone, whatever it is.
Yeah.
Just finding that time to balance in between. And sometimes, I mean, if mothers know it, sometimes you have to shut yourself in the bathroom and be like, kids, do not bother me, please. I just need 10 minutes of me time, please, just to recharge so that I can be there for everybody when I come out.
Love it. It's always great to hear an inspiring story with a cup of something warm or cold, depending on how you flow. But Dr. Brooks really, really laid out a vision that we just get to enjoy the end part of. And I cannot wait to see what becomes of Urgent Care Kids. It is an ongoing story, and Pivot Series is here for every step of the way.